Today, I have the pleasure of having my very own doctor on, Dr. Fraser. Everyone calls him Doc, but he is the founder of Flying Horse Medical in Colorado Springs and Monument. He graduated from Michigan State. He's married, has 2 kids, works out at Orangetheory, is truly an amazing doctor. And he has a knack for taking really hard things and breaking them down and making them seem so much simpler so everyone can understand. And that's what we did in today's conversation with GLP-1s. I can't wait for you to hear the conversation today. Who's the person you're being? Are you satisfied? Welcome to Be the Person, a podcast for the brave and the curious, for people ready to explore their true potential. I'm your host, Annie Randall. Join me and let's get ready to go on this journey together. Welcome to Be the Person podcast. You are in for such a treat today. I have Dr. Fraser. He goes by Doc here with Flying Horse Medical. He's also one of our Orangetheory members. And I'm super excited to have Doc on today. Welcome to the podcast.
Thank you. Appreciate that very much.
Yeah, I would love for you just to start. Tell us a little bit about you, and I would include your practice in medicine because I know it's different than maybe the traditional practice that somebody is used to going to their doctor.
Yeah, of course. Well, again, everyone calls me Doc. My name's Dr. Fraser. I started in medicine at Michigan State University. That's where I did my education and residency. Then I went to the military. The military brought me out to Colorado Springs at the United States Air Force Academy and got a quick education in other than just family medicine over there, including being deployed to Afghanistan. And there I learned that in both my residency and at the Air Force Academy in the military, not because of anybody in particular, just because that's the way we've set up medicine, is that we treat people like numbers and not like people, individuals. And I didn't really like that. In fact, in the military, you actually have your last 4 of your social, and then there's a 2-digit identifier, whether you're military, a kid of the military, or a spouse, or like a second spouse or whatever. And literally that's your number. And that's how they identify you. It's a little crazy. So literally people were numbers, and I didn't like that. So I went and started a practice where it wasn't insurance-based, where insurances weren't dictating to me how I could practice medicine. And because I didn't like the way things were being done and how things were being practiced. And so I started Flying Horse Medical Center, and we started basically a concierge model or a direct primary care model where people pay a monthly fee and they see us whenever they want. And it encompasses all their visits. If they need to get seen 10 times that month, they're seen 10 times that month. If they need to be seen once that month, they're taken care of. And so we've grown from a small practice just down from Orangetheory out Northgate to one facility to we just now, exciting news is that we just purchased our 4th building in practice this last week. So that's a little bit of where we've gone a little bit bigger.
Yeah, congratulations. As a patient, I love what you do and I love how you practice medicine because it really is, one, I feel taken care of, 2, you have time with whichever doctor you see, and that you can actually get in like the next day or the same day many times.
Yeah, that's our big thing, is making sure that our patients get taken care of and getting taken care of quickly. We've kind of spoiled our patients a little bit, which we like doing. But when they try to go outside to other specialties and practices and it takes them months to get in, they get very agitated because they're not used to that, because they can get in to see us. And that's very rare we have to refer out. But when we do, patients don't like it very much because it takes so long to get people in. So
we know each other through Orangetheory, and you're an amazing runner and athlete and work out several days a week with us in our studios. And I often hear people say, I don't have time to work out. But yet you're one of the busiest people I know with 4 locations, a treating physician, has a family, and you still make time to work out. What's your why behind it? And how do you feel like you fit it all in?
I am fairly busy. I always say that if we need to have a meeting, I'm always free between 2 and 3 a.m. It's my 1 hour. I joke around, of course. No, actually, I find sleep is very important. I try to actually get 8 hours of sleep every night. But more importantly than even sleep to me is exercise. Exercise is just paramount so that I can de-stress. Being a physician can be very stressful. Being a father can be very stressful. life can be very stressful, and it's the best stress reliever I have. And it is very, very important to me that I exercise and I schedule it. I mean, I literally put it into my schedule so I don't miss it. I put it in the calendar so I don't miss it. It's so important. And ironically, my staff knows how important it is. I've also still play soccer, like you were saying, and occasionally I get injured. And when I have to sit out for a couple of weeks, my temperament changes a little bit. My staff isn't real thrilled with me. So they even like, I don't care. You got to go do some form of exercise, get back. This last March, I had to have pretty significant rotator cuff surgery, and 3 of my 4 muscles I had to have reattached. And 2 weeks later, I was back in the gym, not using my arm. Of course, it was strapped to my chest, but I was on the treadmill walking. I couldn't run, and just doing what I was able to do because it's still that important. Just it's so important to be able to exercise for me, for my mental health, for everyone else's mental health being around me, because I can be a lot in relationships, high energy and things like that. So it's really such an important factor of my life, and really should be an important factor of everyone's life.
One, I love that you said you just make it part of your daily routine. It's important to you. And the other thing you said is that you actually schedule it. That is one of my favorite sayings. My team always hears me say it: what gets scheduled gets done. Like, put it in the calendar and it'll get done. That you actually put your workouts in the calendar.
100%. I have to. If it doesn't get on the calendar, I have way too many things going on in my life, like between all the locations. And in fact, I tell people, they're like, hey, I'm on my way out the door or something. Hey, can we have a lunch or whatever? I'm like, you got to send me a text. We got to put it on the calendar or it will not get done. Like, it doesn't get done. So with my exercise, it is very, very important. And it literally is on the calendar, and it stays there.
Yeah.
So.
I hope people listening take that to heart and will start doing that practice of putting workouts on the calendar, because we have time if we schedule it.
Yeah, we absolutely do.
Well, I would love to dive into the topic. Right now, it's a hot topic of GLP-1 agonists, and really help us understand it more. Maybe
Yeah.
just start out with the basics of like, what is it and how does it work?
It's a very complex medical issue, but GLP-1 stands for glucagon-like peptide. And so everyone's getting into another big hot topic, and this is just a very small subsection of that, is peptides. But the glucagon-like peptides are the ones where most people have heard either Ozempic or Wegovy or semaglutide or tirzepatide. There's several of them out there. But those are the ones that a lot of people have heard, that basically what it does is it helps regulate people's diet. So a lot of people have a hard time, and I'll be honest, I'm one of them, where get the fast, easy meal in, get the I don't have time to do whatever, and then you end up engorging yourself because it's just like, well, it's right there, or you continually snack. So what the GLP-1s do is basically it stops the hormone called ghrelin. Ghrelin is a hormone produced by your stomach that then goes to your brain and tells you you're hungry. It's what helps regulate your appetite. And so basically it stops the production of that hormone, and then you basically get really full really fast. It also helps, for lack of a better term, it's a lot more biopathophysiciology, but for lack of a better term, what it does is it tells your body to, hey, even though this person's not eating as much, we have a bunch in store, like in our fat stores, and you can go and use the fat stores that you have. We're not waiting for the apocalypse anymore. We're not waiting for our next meal anymore. We don't have to store all that fat. We can go and we can actually use that fat. What's interesting is another topic we've talked about in the past is cardiovascular disease prevention. And that's a big one for me. And we track doing our cardio IQ, which we've talked about before. And what's interesting is with the GLP-1s is that their cholesterol initially actually gets significantly worse. And then everybody's like, what? That doesn't make any sense. Because it actually goes in, like I said, and takes your fat cells, puts it into your arterial system, your fat particles, and then your liver makes it into glucose and usable energy for your body. So initially, actually, people's cholesterol actually initially gets worse, and it's not because the medication is not working. In fact, it is working and doing its job very well. Mm-hmm. And that's how one of the big ways that you start to lose weight is that you're actually burning the fat that you have. Some of the GLP-1s, if you're not using the fat cells appropriately, can start burning muscle. That's why when you use the GLP-1s, it's really important to exercise to make sure you keep your muscle mass. That's a big one. The GLP-1s are actually used initially for diabetes to help control blood sugars. That's what they were initially designed for. But now we don't get hypoglycemia with a lot of other diabetic medications. And they are now been, two of them, the tirzepatide and the semaglutide, have been recently FDA approved for weight loss specific, not even just a diabetic one. The tirzepatide, called Zepbound, is the FDA approved one for weight loss, and semaglutide Wegovy is the other one. Both of those have been approved for weight loss specific. But GLP-1s have been around for 20, 21 years, 22 years. Back when like Byetta was coming out, that was one of the original GLP-1s. Then Bydureon started coming out, and then, which is a substrate of Byetta. And it's evolved to the point now where it's not really for diabetes, it's truly for weight loss. And it works amazingly well. I mean, it's not abnormal for us to have, 80 to 100 pound weight loss for people who really need to lose it. 50 pounds is not out of the realm of crazy. And people's health is just getting so much better. Their back pain's better, their joint pain's better, their A1Cs are better, their glucose is better, their cholesterol is better, their heart disease is better, they're reversing their heart disease. The tirzepatide has actually also been shown as a vascular anti-inflammatory. So even people, when we get down to their goal weight, they like staying on it because they just feel better because of such strong anti-inflammatory effects. It has a lot of positives for patients.
Yeah, absolutely. It sounds like it. Is it fair to say, so it went from a medicine to treat diabetes to now this weight loss drug? Are there certain parameters for insurance companies to cover it that you have to meet for a weight loss drug?
That's a very sticky one. So on average, to get approved, you have to have a BMI greater than 30. And you have to have one comorbid factor, meaning you have to have blood pressure, hypertension, cardiovascular disease, strokes, diabetes, something along those lines for it to be approved. It's not really hard to meet those two criteria. A lot of insurances just don't approve them regardless because of the expense. There's several insurances that do, and we try to get that for our patients. We try to get them, if it's approved through their insurance, as best as we could. But it's I can't tell you exactly what insurance does or does not cover. It's your pricing.
Yes, absolutely. Is it pretty quick? Like if I start to, it's an injection, correct?
It is. Yep. Subcutaneous injection.
Okay. If I start to do the injection, like how often do I do it and how fast are you seeing patients get results?
So you do it once a week. I mean, it's up to your provider and you as a patient, right? But in general, it's once a week and everyone picks their day, and usually it's in the evening. I know you're going to probably ask about side effects. One of the side effects that sometimes happens is nausea. So we mitigate some of that by taking it in the evening. But people start noticing effect like pretty quickly, like within a day or so, in relation to what it has on the physiology of the body. Like you just get full really fast. I wanted to kind of see what it felt like previously. And I did a trial of the lowest dose, and I just have a morning shake every morning. It's just protein powder, almond milk, and some fruit. And that's it. And it literally felt like I had a 7-course Thanksgiving day meal. I was so full. And that was the next day. It was the day after the injection. And the whole rest of that week, I had a hard time just eating. And I felt full. I felt fine. I'm like, I can't eat any more food. Like you could give it to me, but I can't eat it. It's not uncommon for the first month for people to lose up to 10 pounds. That's not uncommon at all. Some people don't lose much weight. Some people will only lose 2 pounds depending on the dosing, and everybody's a little different. So I definitely am not guaranteeing you lose 10 pounds, but it's not unheard of. And some people, they lose 10 pounds a month, which is a little too fast. I like to see around the 4 to 5 pound per month mark just to keep it a little bit more sustainable for the patient, but it works very quickly. When people go on diets and change the way they eat, they have that nagging feeling in their head that they're always hungry or their stomach hurts because they're hungry. And if I could just eat that one chip or whatever, I'd feel better. But then they eat the chip and they feel bad because they eat the chip. And it gets rid of all of that. Like you don't care. It also decrease your want and need for alcohol, for smoking. Like you just don't care. You don't want it.
Wow. Do you feel like you need an adventure or a new challenge in 2025? Join Jeff and I on our Peru trip. We're going to do a 1-day hike to Machu Picchu, has always been on my bucket list, but it's becoming more and more restricted. So right now you can still walk around Machu Picchu, but I believe that won't be the case for long. We're also going to explore the Amazon jungle, the city of Lima, have the option to hike Rainbow Mountain. It's going to be a wonderful trip. It happens next September. See all the full details in the show notes. Well, you mentioned it earlier, how important it was to be working out if you're taking this or doing the injections. Tell me a little bit more about that so you lose fat instead of muscle.
So it's really important to, one, for the cardiovascular health, just in general, it's still good to exercise. And to be honest, it's an adjustment period for that first 1 to 2 weeks, actually, because your exercise is not going to be as effective. So it's really kind of hard to push through those first 2 weeks. But it's still really important to you. So you're moving your muscles and you're using them so you use them or you lose them, right? So it's really, really important to continue to exercise so that your muscle loss isn't there. But now, first 2 weeks, because you're not taking in the calories and your muscles are used to getting calories right away from your liver, and it's not there because you just physically can't eat as much, it's a little bit harder of a workout for the first 1 to 2 weeks. And then your body adjusts and it knows the liver starts producing the sugar a little bit easier, a little bit better for you so you can have it a little bit easier on you.
I think that's important because we know muscle is what burns calories and what is really the key to longevity. So I think just hearing that from you that it is important to continue to work out, even those first couple weeks when you have to push through, of just how important keeping that muscle mass is as you take it and as we age, especially.
Yeah. Well, and it's again just having the conversation with your provider, your doctor, whoever is prescribing it to you, and it should have the conversation about your exercise. You still need to exercise and just have realistic expectations of yourself. Like, okay, I'm going to take this medication. Today is not the day. I'm going to go set my old benchmark, right? Give yourself a little bit of grace. Instead of your normal base pace on the treadmill or whatever, back off a little bit or make it a walking and push yourself on the walk, which is also really important and good for fat burning because we do it at Orangetheory, we do it on incline. So just give yourself a little bit of grace when you're starting off in the first couple of weeks for sure. But it's still really important to do it so you don't lose it. You use it or lose it. It's important to burn those calories, but also just so you don't lose muscle mass, which is what unfortunately some of the GLP-1s can do if you don't exercise with it.
Yeah. What would you say as far as like, do you see some patients, maybe they are 100 pounds overweight and they start to lose that weight and then their body is more able to start to exercise? Do you see that happening as well?
Well, exercise is important no matter how big you are when you're starting a weight loss program. And it just depends what your definition of exercise is. So for the patients who I'm having start just even moving, if they are 100 pounds, let's say overweight, a good walk for 30 minutes doesn't have to be on a treadmill, doesn't have to be up a hill, but a good walk for 30 minutes, just getting out and moving is so important. And I have that conversation with every single one of my patients when we talk about weight loss. It's not just the diet, it is also the exercise. And it's the small steps that you can take, even if you're 100 pounds overweight, that the hardest step is usually the first one, but that's the most important one. And that goes not only for the weight loss journey, but also for the exercise. And even just taking a walk is sometimes one of the most important steps.
Exactly. I think just getting started. It's January. Everybody has the New Year's resolutions. And I think just to start somewhere, sometimes we jump in and it's too big. But like you said, it can just be walking and it doesn't have to be fast or uphill. You just have to start.
Yep, that's exactly right. I mean, everyone has different goals and everyone should have realistic goals and everyone should set realistic goals for themselves and talk with your provider about setting realistic goals for themselves. So, absolutely.
Is this a lifelong medicine that people would be on, or could they have the expectation I could take it while I lose the weight and then be able to come off of it?
So, the answer to that is, again, something you talk with your provider about. So, I have a mixture of all of the above with my patients. Ironically, most people have the initial intent of going on the medication and then coming off. I mean, a vast majority. That's their initial first step. And so I have one in mind. She was a professional dancer, had to have both knees replaced, gained a lot of weight, wasn't able to dance anymore. So we basically helped her lose her weight, and she felt so good. She went back to professional dancing. Really, really sweet lady. And she's like, okay, now I'm at my goal weight. Let's take me off. So we started weaning her off, and we do it very, very slowly. Because if you do stop the medication right away, like all those hunger pains come back like immediately, and most people gain the weight back right away. So it is very important to just wean off, not just stop cold turkey. That is really important. And then also like separating it, because the medication can actually last up to 10 days, depending on the type of medication you're using. So even weaning it down and then going, instead of going every 7 days, going every 10 days and every 15 days. But anyway, we got this very nice woman off the medication. And about 3 weeks later, she came back. She's like, nope, I don't like it. Because it was such a strong anti-inflammatory, she wasn't gaining weight. She just didn't feel good. She didn't feel like she had on the medication. She just wanted to go back on the lowest dose, and every 10 days instead of every 7. And she felt good. And that's what we did. That's what she wanted. And we listened to our patients and try to help them live their best and healthy life. I've had some people just, we got weaned off, and they're happy to be off, and they've lost their weight and they're good to go. Some people, they lose their weight and they start to gain some of the weight back just because they start going into old habits, and they want to go back on because they don't want to go back into those old habits. So everyone's a little bit different. And again, it's a conversation to have with the provider. Most people that we have initially, like I said, have every intention of coming off. And when we start that process of coming off, most people want to stay on it. It's not because of cost, or they just want to be on it. They feel better on it. So I'm like, okay, there's no harm in doing that.
Yeah, that was my other question. Is there any side effects, or does it do anything where it would, I don't know, be not good for the patient to stay on long term?
No, because it's not like you're going to continue to lose weight. It does help with your ghrelin production in the stomach, so you're not as hungry. You don't want to be at the highest dosages trying to continue to lose weight once you've got down to your goal weight. I mean, you definitely want to wean down and to maintain and like I said, with anti-inflammatory effect, feel better. Like I said, the GLP-1s have been around a really long time. Not a really long time, 20 plus years. So a decent amount of time. And I know there was just a report, I have not had a chance to read about something going on with semaglutide and long-term use. I haven't read it. There's been a lot of other studies that say it's safe. Tirzepatide, like I said, been around for a while. And some of the other ones have been around a long time, and people have been on it for multiple decades and doing just fine.
Why do you think now there's been kind of this explosion in them? Why do you think, if they've been around for so long, but so many people are taking them now?
Access is one, FDA approval is another, and then FDA approval specific for weight loss, right? Some of them more safety and efficacy. But in relation to medications, in all my years of medicine, this is the biggest game changer I've ever seen in relation to any type of medication that can affect so many aspects of someone's life, not just diabetes or weight loss, but I mean, all aspects: diabetes, weight loss, cardiovascular disease, joint pain, back pain, you name it. If someone can lose 50, 60 pounds because they have the extra weight to lose, their health aspect is just astronomical. It truly is a game changer. It really is.
Yeah, I would imagine if they lose all of that weight, just everything in their blood work and just all the health measurements significantly changes.
It is. I've had somebody in complete kidney failure, not complete, but stage 2 or 3 kidney failure, and their kidneys get better and come back to normal because all that weight, I mean, liver disease comes back to normal because they don't have the extra fat in the liver that's damaging it. People with cardiovascular disease living their much healthier life. It's just so impressive what weight loss can do to a person's lifestyle.
Yeah. One
Health.
of the things I've been hearing more and more about is microdosing of the GLP-1s. Is that something you're seeing, and can you talk about that?
So this is getting into a little bit of things that we have to be careful talking about because it has microdosing in relation to your compounded versions, right? So you have ones that are FDA approved that go through certain companies, and that's like your Zepbound or your Wegovy or your Ozempic or et cetera, et cetera. Yeah. And those are FDA approved and they have patents on those. But one of the things that we use is the compounded version because for a couple of reasons. One, there's a critical shortage. They keep taking it off the critical shortage list, except I still can't get my patients who are on it filled, specifically the tirzepatide. Manjaro is the one that's tirzepatide for diabetes. And the Zepbound, I mean, we cannot get those at least half the time, the pharmacies just are out of them. But they're Eli Lilly and a couple other companies are trying to get it so that you can't get the compounded versions. That's where we have to be a little bit careful about how we talk about them. But the microdosing is much nicer because, one, you just kind of suppress that hunger for people who just need to lose a couple of pounds, and kind of helps jumpstart their weight loss journey, where you're not really, you still have a significant effect in relation to the ghrelin production, so you're not as hungry, but you don't get as full as quickly as you do if you do like your standard dosings. But you can only do the microdosings if you're able to compound it. And so the compounded versions are as effective. We have them as effective as the other ones. And we're just able to dose them differently than what it comes in a standardized dosing pen for like your Ozempic or your Mounjaro or your Zepbound or your Wegovy or whichever one it is. They come in pens that are set at dosings. You can't change that dosing. When it's compounded, you can set the dosing, and it really does help. I mean, people who just need to lose a couple of pounds, or sometimes we don't even do it every 7 days. Like I said initially, the medications can last up to 10 days, and we do it just much smaller dosing and get it to that. The people who are, for the most part, really healthy, really, really healthy, but they're like, I got 5 pounds and I cannot lose it, and they're doing everything perfect, right? So this kind of helps them get over that hump and get them to where they want to be.
Gotcha. Well, I learned a lot in our conversation. You hear a lot of different things, but I always love to hear it direct from a medical professional. So I appreciate you shedding a lot of light on that. Any final thoughts overall on this topic that we haven't talked about?
I mean, you hit a lot of the big ones that I get asked all the time. Obviously, you need to talk to your provider. Like, this is not a blanket statement like, hey, anybody and everybody can do this. There are contraindications. People who've had chronic pancreatitis, thyroid disorders, specifically thyroid cancer, a very specific type of thyroid cancer too. You need to talk to your providers specifically about that. But there's a lot of people who qualify, and it helps a lot of people. Like I said before, it's such a game changer for people that they just can't get over that hump. They've tried everything from diets, exercise, or like they've been perfect on everything. Their hormones have been optimized, and they're like, I just have these 5 to 10 pounds I can't lose no matter what I do. Or you have the people who are like, I am so far gone, there's no reason even to start or try. And this medication really helps those people get over that hump and get them to where they want to be. Like I said, in all the weight loss medications and all the medications that have come out in the last 25, 30 years since I've been practicing medicine, it's just so different. It's pretty amazing actually what it's done for the people of this country.
Well, I appreciate all of your insight on that. I appreciate really, one, that you live the example, you're living the healthy lifestyle, and then you're also just have created this practice, which I believe is changing so many people's lives on doing medicine and listening to patients. And I love everything about that. So thank you for what you're doing.
Oh, thank you. Appreciate it.
Thank you all for joining Be the Person podcast. I appreciate you tuning in today. And if this resonates with you, or you know somebody that could benefit from hearing it, please share it with them. And always, it would mean the world if you would give us a 5-star review. Thanks for joining today.